Hi, my name is Barry Parisien. I'm a denturist and the owner of the Parisien Denture Clinic in Windsor, Ontario. And I had somebody ask a question on one of my recent YouTube videos. Genevieve had asked if I could talk about bone spurs for a little bit. She said, I would love for you to do a video on bone spurs and what can be done to relieve discomfort from them. Also, what can we do besides getting them cut out, or if they are really small, to get them out? I have several on my bottom jaw and none on the top. Is that normal as well? So when it comes to bone spurs, there's a couple of different things that you might consider a bone spur. There's an actual bone spur, which is typically right on the bone. It's attached to the bone. A lot of the times it's a sharp little spot that was left over after the teeth were extracted. Because when you pull the tooth, you're left with a socket. You're left with this hole. And sometimes the edges of those holes can be sharp, and you might have a little jagged piece of bone that was sticking up. And you can imagine if you have that jagged little piece of bone, for lack of a better term, probably almost like a little needle, and then you have your gums over top of it, and then you put a denture on top of that that's putting pressure on the gums, and it pushes down. It can be quite painful, as any of you who have bone spurs definitely know. The denture normally can just be adjusted in the area where the bone spur is. You basically just grind away some of the material so it's not putting pressure in that area, and typically that's enough to do the trick. The bone spurs, if they're there from the extractions, they will typically go away over time if they're not that severe. Sometimes if they are big, you might have to go and have them shaved down. It's going in for another surgery. They'd have to open up the gums a little bit and just trim that down a little bit. You don't see it that often to that extreme. Now, the other thing that also could be happening is you could have a little bone chip. Basically, again, you have this socket for where the tooth used to be, and sometimes when they're trying to get the teeth out, the edge of the bone might chip off a little bit. And those end up being, I guess the best way I could describe them, they're like a sliver. They're like a sliver of bone. And again, they're quite sharp, or at least they're going to feel very sharp underneath the gums. And again, you have that denture that's pushing into the tissue and pushing the tissue up against this sharp piece of bone, and it hurts. Luckily, the little bone chips, they typically will come out on their own, give them enough time, but for the meantime, I know they can definitely be very painful. Again, really the best thing to do is have the denture adjusted in the area where the bone chip is, and it'll just relieve the pressure on it. And hopefully, you don't have to go to the point where you have to have it surgically removed. Again, sometimes that does happen where the bone chip is big enough that it just doesn't want to come out on its own. You can get, when you start to see them poking out of the skin or the gums, and they will eventually normally start to work their way out just like a sliver. When it gets to a certain point, you can normally grab a hold of it or get your fingernail out of it, and normally you can pull them out. I would suggest letting your practitioner do it, because they could splinter, and then you just end up with another bone chip in there. So let your practitioner do it. That way you know it's going to be taken care of for good. But those are generally the two things that can happen when we're talking about bone spurs or possibly bone chips. They're a pain, but normally it's just an adjustment to the denture, and they will work themselves out on their own. So I hope that answers your question, Genevieve. And if anybody else has any questions or comments, please write them down below. Or if you have any ideas for videos that you'd like to see, please just let me know. Take care.